We got used to the concept that there are pesticides everywhere and we have to live with them. People are starting to accept it's okay to have a little bit of glyphosate, a little bit of pesticide. So we are really bombarded with pesticides, and pretty much we are being poisoned. Even if we eat organic, you can't escape. All of us have glyphosate in our blood.
This is Dr. Talks.
Welcome to this episode of the Environmental Toxicants, Autoimmunity, and Chronic Diseases Summit. I'm Dr. Wendy Trubo. My co-host is Dr. Edward Levitin, and today our guest, hold your breath, is Dr. Isaac Eliaz. I guess that's kind of literal for someone who does meditation, perhaps, hold your breath. Anyway, Dr. Eliaz is a leading expert in the field of integrative medicine, specializing in cancer, detoxification, immunity, complex conditions. He's a respected physician, researcher, best-selling author, educator, and mind-body practitioner. He partners with leading research institutes, including Harvard, National Institutes of Health, Columbia, and others to co-author studies on integrative therapies for cancer, heavy metal toxicity, and others. He's also the founder and medical director of Amitabha Medical Clinic in Santa Rosa, California. So as Bostonians say it, he's wicked smart. So Isaac, it's a pleasure to welcome you here today. Thanks for being on this summit.
Yeah, thank you so much for inviting me to be part of this important summit.
This is all about what's near and dear to our heart, which is what gets in the way of successfully detoxing and working on the survival paradox in general and being symptom-free.
So what is the survival paradox?
Hold on.
Let's start there.
This is what we're talking about today.
Yeah. So, the survivor paradox, as it sounds, as the name says, it is a survivor paradox. We are all built to survive. We are wired to survive as people, as communities, every cell in our body. And our survival response, what keeps us alive, is actually what causes us to get sick. On an acute basis, it would drive sepsis, for example, chronic diseases, but it's also what makes our life difficult. It's what creates struggle in us. So in the integrative medicine field, we are aware now, and now Western medicine with the COVID is very much aware of the inflammation driving every disease. But inflammation is really not a cause. Inflammation is really a result. And the imbalanced survival drive is what drives inflammation. And that's really the new paradigm that I'm introducing. And from what we chatted before the interview, the question is, of course, which I don't touch usually in interviews, is what causes the survivor paradox? Mm-hmm. What causes us to struggle? What causes us not to accept? And I touch it at the end of my book. And it's really kind of getting to the end. In the beginning, it's really that we can't accept that everything is changeable. We hold as permanent to what is not permanent. And that's really the basic survival drive. It's a basis, and it's in every human being, every living being, and in every cell. So as such, it will change our nervous system response through the autonomic nervous system, because if we are wired to survive, it has to be automated. We can't control it. So the sympathetic system responds in a fraction of a second, either with fighting, which equates to inflammation, or running away, which equates to hiding, to creating a microenvironment, to creating fibrosis, to creating a biofilm, an area where diseases can develop in isolation from the body. And then on a biochemical level, within minutes, a protein called galectin-3, which I've been researching for almost 30 years and made some of the most important discoveries, turns on. And galectin-3 as a driver of the biochemical survival response doesn't turn off as quickly as the move between the sympathetic and parasympathetic system. So the alarm system turns on, and then the consequences can be pretty devastating.
I have so many questions from this.
You do?
No,
That's surprising.
Our kids went to a school where they taught them to say, I have a question, and they brought it home to me. So I have a question. So I think the first thing I heard in what you said was that being rigid and inflexible actually directly leads to disease in ways, because causes us to resist the flow. Is that what you said?
That's a really, it's one of the things, it's interesting, it's totally true, because flexibility and flow is a definition of life, right? Like heart variability is a definition of being alive and healthy, right? There's a variability in the heart. So when we lose our flexibility, it's like a rubber band that loses its flexibility, it's going to tear apart. And part of it is being rigid, right? The tree that will withstand the storm is a flexible tree that can bend and come back. So in this sense, it's true. But if we think what it means from a living point of view, is accepting somebody else's opinion. You know, kind of pretty relevant right now, right? It's being more flexible in what is okay with us. So it's very interesting. We are really jumping, but actually that's kind of the associative nature of what the three of us are. If you think there is now an epidemic of mass cell activation, right? Everybody's talking about allergies. Why is it happening? Why suddenly we are allergic to something that we were not allergic as much 30, 40 years ago? And toxins are huge, of course, and we'll talk about them. But part of it, what is allergy? Allergy is an inappropriate response to a stimuli. And what is, per definition, it's losing the flexibility to tolerate something we used to tolerate in the past. Right? So we do elimination diet, but if we were really healthy, we could eat anything.
Right.
So this is, for example, an example of losing flexibility, losing tolerance psychologically, emotionally, as a society, intolerance on a cellular level. So we respond with inflammation. And the results are devastating. So that's an example. That's the beauty that we all know. When you have the integrative medicine model, right, every patient is amazing. Every situation is amazing. Why? Yeah. Because we see all these connections, like, wow, you know? But if we look at medicine as a algorithm-based, you know, go right, go left, yeah, it's not surprising that regular doctors have a hard time in patients. They lost the flexibility, like you said, not to be so rigid and to think out of the box. So as part of it, the survival paradox is really a way of life. It's really understanding that we can get to the same place with less effort. And we all fall into it. I fall into it. You fall into it. Every person falls into it. The beauty is that we have a chance with every breath, with every thought, to snap out of it. That's really the beauty.
I want to make sure I don't steamroll over where you might go, because I have, to me, this so perfectly when you talk about hypersensitivity and the way we react. We're all detox docs in this room. So I just come down to, if I can't get a handle on you, it's because there's a toxin or a toxicant that's making your system jacked up, less resilient, turn on something it shouldn't, respond how it shouldn't, and let's clean up your system. I know you've developed the PectaSol, which directly helps with detox, but can you talk about the role of toxins in this lack of flexibility?
Yes, of course. So we will stay, and let's focus first, like on chemical toxins, on real, but of course, emotional toxins, psychological toxin, traumatic toxin, epigenetic toxins, they do the same. Because the bottom line is, if we can get the cellular membrane to function normally, to feel safe, not to be in a survival mode, then insulin receptors are working well, AMPK gets upregulated, mTOR1 gets shut down, the mitochondria is opened, we are home free. We produce energy efficiently and slowly with no byproducts. Anything that disrupts it, we are in trouble. And toxins is the biggest bucket of it. And looking at the physical toxins, you know, there was a lot of attention. I've done breakthrough work on heavy metals with Modified Citrus Pectin, with PectaSol over 20 years ago. Actually, it's a discovery I made. Yeah, I don't have patents on it anymore. I discovered it so many years ago. And it was really remarkable. Here was a substance that could actually remove selectively heavy metals. And then my attention went more to environmental toxins and to to mycotoxins that now there's a big issue, and it's part of the imbalance of the microbiome also, right, and the biofilm. But somehow, all of us, at least I was guilty of it. We got. I don't know if the word brainwash is the right word. We got used to the concept that there are pesticides everywhere and we have to live with them. People are starting to accept it's okay to have a little bit of glyphosate, a little bit of pesticide. So we are really bombarded with pesticides. People don't realize 1 pound per person per year of glyphosate. And guess what? Glyphosate is one of 20 or 30 pesticides that are highly used. So glyphosate is the most popular one. It's 80% of the pesticide, but you got so many other pesticides, and some of them are in the same formulation that doesn't have the regulation. You don't have to regulate the formulation of glyphosate. And pretty much we are being poisoned. Even if we eat organic, you can't escape. All of us have glyphosate in our blood. So
organic
now,
chickpeas are all contaminated with glyphosate.
all of them.
Yeah.
Yeah.
Yeah, you're going to get Wendy started because she just did a talk on glyphosate.
I know, just talk on that. But I don't think that we're brainwashed. I think it's more about lack of knowledge. People don't even recognize that their food at every level, that the ground has been sprayed to speed up the drying, to speed up the harvest cycle, to prepare the ground for the next cycle. Nobody has any clue. So I think once they recognize it, they go, oh my gosh.
Actually, I don't think that's even that far. I think they trust the FDA to do the government to protect us, quote unquote. And the problem is the government is not interested. That's not. I
don't want to go too far down that rabbit hole, but I think that, but the majority of people aren't necessarily thinking through, oh my goodness, all of my food has been sprayed. And when I drink juice, it's been concentrated. And when I drink wine, it's concentrated down, you've actually made it more, and high fructose corn syrup with the mercury and the glyphosate. Right. Yeah, he did get me started. Yep. I'm all riled up. I'm like, oh my goodness.
No. It's for me, I treat mainly cancer and how to treat illnesses. So, and I did a lot of work with Lyme disease, a lot because of family issues. Now everybody is healed. They don't have to focus on it. But I've gotten successful with my patient. I get good results. And I realized there are a certain category of patient where there's an obstacle to their healing. It's not happening. And what I found I was missing is the need for additional emphasis on detoxification. And in this sense, it's key because our cells will adapt themselves because they want to survive. We have an adaptive metabolic system. Glycolysis is an adaptive survival mechanism, right? It produces energy 100 times faster. That's pretty much what happened when in the fight or flight, you got to produce energy. Extremely inefficient, as the audience, people are not doctors, may not know, only 2 molecules of ATP, 2 molecules of energy from 1 glucose compared to 36, but a lot of nasty byproducts and hypoxia, and the cell goes, the cell goes out of balance. And pesticides and toxins really contribute to it because they change the extracellular environment. And galectin-3 drives a lot of it. If I didn't mention it in advance, but if you will give me a permission to share, I can even show 1 or 2 slides if you feel like it, and I can show some example. We don't have to, but if you want,
I'm happy to. But you are challenging my actual technology skills.
So these are some of the ligands that are driven by galectin-3. So why did we talk about galectin-3, and to explain what happened to the cell with toxins? So galectin-3 is a carbohydrate binding protein. So it binds to different sugars. So once it hears that there is a problem, we want to survive. So it runs to survive by repairing through inflammation and fibrosis. It binds to different ligands, and then it creates this pentamer, this coating right? It creates a pentamer and a coating, literally a microenvironment. And this microenvironment around the cell, around the tissue, these are the arteriosclerotic plaque, the area around cancer, but also where toxins can hide, ideal for them. And then what happens, it will deliver all these different ligands that drive cancer, that drives the stickiness of the blood, that will shut down the immune response, that will create neuroinflammation. We know toxicity and neuroinflammation. They will come into this area and change the metabolism outside the cell. The receptors will change in the cell, and you'll get an abnormal metabolism. So if we have a high toxic burden, we're not going to be able to shift our health, because even if we did an amazing work on our own, if we have, it's an obstacle, as you mentioned before. You got to remove the barrier. And
so how do you do that?
Well, can we back up a second? Because before we go into that, you said something that I'm not sure the listeners may have completely clued in on. Is you were talking about the difference in energy production from glucose, and that it's much greater, but you didn't specify what it was much greater with. And I'm assuming you're talking about ketones, but I want to make sure that we're on the same track, because
ketones is another survival mechanism. Ketone is a long-term survival mechanism. But basically, when you take glucose and you produce energy through aerobic normal metabolism, you get 18 ATPs. You get 36 ATPs. When you produce it through glycolysis, you get only 2 ATPs.
Okay.
So only 5% efficiency, that's how bad it is, but 100 times faster, right? So you still can get a lot of energy. So the body is built to survive, as we said, right? So short-term survival, that's a really damaging survival, that's glycolysis. The long-term strategy survival, that's ketone bodies. That's right, that's what happened in long starvation. Both are starvation approaches. So, for example, if ketogenic diet was our preferred diet, we would have been doing it all the time. But intermittent fasting, for example, now we're really jumping, but it's fun. Intermittent fasting is fascinating because it gives the cell an opportunity to recalibrate. And that's why there is so much interest in intermittent fasting and so much science behind it, to be used in general and specifically as a way to positively manipulate certain treatments in certain diseases.
So when you say intermittent fasting, a lot of people have a lot of different ideas of what that is. Is that a 12 and 12? Is that a 18 and 6? What's
12 and 12 really will not do the trick, as we all know, right? It really I'm a numbers guy and a scientific guy. It depends on also what you eat. If your last meal before you did intermittent fasting was low in carbohydrates, right, then you will have less glycogen built from excessive sugars, right? From glucose. Glycogen, people don't know, it's like the reservoir of sugar. So glycogen will break down in 12 to 18 hours, sometimes 24, depending on our diet and the state of our liver. But usually, you really need 16 hours. You can get away with 14, depending on the hours of the day, if you give yourself a break between eating and bedtime. And so there are so many techniques, each one has their own way. Some people will do 16A, some people will do 16-8, some people will do 18-6, some people will do 14 fasting 10, but take one day a week where you do 20 or 22, or every other week, 2 days. It's about allowing autophagy, it's allowing the cellular metabolism to adjust. And if we do it in time, we also give a break to our gut. That's why we do it in a way where dinner is eaten early, whoever can do it with their lifestyle. Then also the gut is getting a break. Then also you want to look at the cell as a membrane, right? The cell as a membrane decides what comes in and what doesn't come in, and what goes out. Well, there's a very big membrane in our body called the gut, which decides what comes in and what goes out, right? Very similar, but in different scale. And this membrane has a lot of neighbors, right? About 100 trillion neighbors in the microbiome. So if we synchronize the hours of the intermittent fasting also to giving a break to the digestive system, then we get more for our effort. So in this sense, intermittent fasting is really something that can become a long-term habit, and many cultures used to follow it naturally. It was dark, it was hard to cook, and you would eat your last meal in the late afternoon and then wake up in the morning, and once you do a little bit of activities, it's already 14 hours, right? It's already 16 hours.
Mhm.
So, and many Asian cultures, many of the monastic cultures, right? So intermittent fasting is very important, and it's especially important in integrative oncology.
Now, so it's interesting because you bring up a couple of different points for integrative oncology. A lot of physicians talk about a ketogenic diet,
Right.
not intermittent fasting.
Right.
Is there pros and cons of that?
So I remember that at A4M, I was one of the staff that taught in the integrative oncology module. And I forgot his name, the person from Boston who wrote the big textbook on ketogenic diet. And everybody was excited. It was Sigrid?
Sinclair, David Sinclair?
No. Prior to him.
Not sure.
I think Sigrid was his name.
Okay.
Yeah, he wrote a big textbook. And yeah, people were very excited. And I told on the stage, don't overuse ketogenic diet. Leave it for when you need it, So ketogenic diet is very useful, especially in high glucose metabolism cancers like glioblastoma. But you want to use it when you want to enhance the pressure on the mitochondria. So for example, certain chemotherapies that create oxidative stress and DNA damage, like adriamycin, and the platinum drugs, then ketogenic diet will go well with it. It's very important around radiation therapy, where you want the mitochondria you want the cell to be starved. And in this sense, intermittent fasting also is very useful. But we have to understand, if ketogenic diet was a cure, everybody that went on ketogenic diet would get cured from cancer. It's not the case. Why? Because the cell adapts. The cancer cell figures it out. So we have to be smarter than the cancer cell. And we have to create something which is dynamic, where the diet changes. If you look the way I give supplements, for example, in cancer, I change my supplement during let's say a 21-day cycle. I don't give the same supplements all the time. The intermittent fasting is built in, right? The diet is changing. It's not the same. So in this sense, it's an advantage. But yes, I usually I use ketogenic diet around the first half-lives of the drug, the first 2 half-lives. So most of the drug is driven into the cell because the cell feels a sense of starvation because it's used to taking glucose. It hasn't adjusted yet. And then they go just on a low glycemic intermittent fasting. And by doing this switch, you get really good results. And you want the normal cell to be inactive so it doesn't get damaged by the drugs, by the radiation, right? But if you keep the cell on ketogenic all the time, the normal cell will also get used to it and become active. So we have to be a little bit creative, and we're going back to the first comment. We can't be rigid. We got to be flexible. And also in our regimen, our thinking, and it's tough. We are in the same boat, but for regular doctors who need a regimen, it's hard. I always say that the only protocol I have is that I don't have a protocol. So that's really the basic principle.
Now, okay, so going back to the cancer piece, a lot of doctors, integrative doctors will not detox cancer patients until they're a lot more stable, or they feel like they've gotten to a certain point. Right. What's your approach to that?
What a great question. And it's important within the context, again, going back to the survival paradox, galectin-3 because it's the bus that drives all the inflammatory compound. It drives the abnormalities. You know, if there's high galectin-3, for example, you will not respond to immunotherapy. No, this summit will be broadcasted in the future, but today we are presenting our multi-center trial on our modified citrus pectin biochemical relapse of prostate cancer with 90% benefit.
Wow.
So different. So it's kind of like an exciting day for me. It's only 10 years of work, you know. And so it's presented in Europe today. So going back to cancer, it's a very good question. So we want to remove the toxins that are circulating. We don't want to open the drawers and get out of the drawers the toxins that are hiding, because our body won't be able to eliminate them. You know, there's discharge, phase 1 and 2, there's elimination. So the body has to be able to really eliminate. So within it, when you look at cancer, there is, when the patient is getting the drug or the radiation or the herb or the formula, our focus should be to deliver the medicine to the tissue. And one of the main issues that why it won't happen is because of hyperviscosity, because the blood oxygen is not getting to the tissue, right? That's an acidotic tissue, that's abnormal, and the cancer knows how to do it through the Warburg effect, right? The cancer, even if there's oxygen, it produces energy through glycolysis, and it's driven by galectin-3, by inflammatory macrophage that affects insulin receptors, etc., etc. So the dietary regimen, the ketogenic diet, it's already intracellular into the mitochondria. We are dealing earlier on the whole environment. Galectin-3 drives it. That's why using PectaSol is so fundamental. It's, in my opinion, the most important supplement that someone can use. And finally, it's coming to the awareness. So going back into the cancer patients, the first thing, get the medicine to place. So herbs that help circulation, a little bit of exercise, good hydration, light food, get the medicine to the tissue. Then the medicine is in the tissue, you have a breakage of tissue, now you need to do cleanup. So if we look at let's say we look at a 21-day cycle, around day 6, 7 to day 14, that's a good time for detox, but very mild detox. So you don't want to push, you know, you want, you know, not strong cleanses, but definitely more detoxification, liver support herbs, definitely a little bit of saunas even, it's fine. Especially if you can combine it with intravenous therapies, with, you know, vitamin C being the king. And in my clinic, I specialize in a unique process called therapeutic apheresis, which is a very high-tech dialysis-like process. Then we do it more closer to the cancer treatment, because we are removing the inflammatory oxidized lipids and we're exposing the cancer to the treatment and enhancing the immune response. So that's the part where we detoxify. And then towards the next cycle, we need to nourish. We need to make the body strong enough to handle the next cycle. And this is really how the detoxification needs to go. Detoxification is not an ongoing process when it's more enhanced. And in fact, if you're interested, we can take a step back. And in my book, after I explain the survival paradox and galectin-3 and what to do about it, and I go over every category of major diseases, I give the 3 chapters of solution. And the first one is detoxification. And it's a little bit of a mystical term. What is detoxification? We actually detoxify all the time. Every time we exhale, we detoxify. Every time we inhale, we nourish. Well, exhalation is twice as long as inhalation, right? So we detoxify 2 parts in time compared to 1 part of nourishment. So obviously, detoxification is fundamental to us. And so it's important to realize, so when we detoxify, the first step in the preparatory phase, in fact, I have a slide for this, believe it or not. So if you look at this, the first thing in a detoxification is really preparation. You know, we don't talk about it. And what do we want to detoxify? So many people say, I'm doing a detox, but what do you want to get rid of? Do you want to get rid of your heavy metals? Do you want to get rid of your pesticide? Do you want to get rid of your relationship? Do you want to get rid of your traumas, you know?
Now we're married, so are you saying, are you inferring something or?
No. I'm talking in general.
We do have a talk on trauma in this summit. So
yeah, so very
that.
important. So it's very important because I do a lot of work with trauma with the meditation. So once we figure what we want to do, the body is wise. The body always wants to survive. So the body is going to help us do it. And then we got to expose. So exposure is what we discussed with the cancer, right? We got to expose the tissue. So in general, you know, when we talked about chronic disease, addressing biofilm, enhancing the immune surveillance, that's in general. And that's why, for example, if there's high galectin-3 and there is this lattice formation, immunotherapy in cancer doesn't work. Merck knows it. You need to block or reduce galectin-3. There's interesting research going on it. And then once we expose, then we can bind different toxins. So I give you MCP alginates, you know, humic acid, fulvic acid, shilajit. There are different binders, you know.
Now, what is the alginate?
So the alginate is similar to, the alginate is belong to the same group of polyuronides, and it's from kelp.
Okay.
But it has a different profile. And when you put them together, it works better for removal of toxins, especially in the gut, because it's higher molecular weight. MCP, modified citrus pectin, is not regular pectin. I mean, PectaSol has 80 published papers on multiple conditions. Why? Because it has a specific low molecular weight. It gets absorbed into the bloodstream. Regular pectin does not get absorbed into the bloodstream. So there are different binders, and then we got to discharge and eliminate. So when we discharge, that's when doctors with cancer say, don't overwhelm the cancer patient, but it's not really accurate. You got to support the liver, because guess what? The liver is overwhelmed anyway by the disease, by the byproducts of the killing of the cancer if it's successful, and by the toxic medications. So you have to help. You got to detoxify. And it may be something like hot water with lemon, you know? Or it may be something that is mild. It can be certain herbs that support the liver. But we always want to support and balance and help energy production. And if you look at the cancer process, that's what actually happened. This is not a slide for cancer. That's a slide for detox. But that's the process during the cycle of cancer, right? Towards the next cycle of treatment, we want to have enough energy in the body. We want to protect all the organs of elimination so they can actually eliminate the toxins and keep working. So yeah.
Sorry, Isaac.
Yeah, no, go. Please go ahead.
You put the modified citrus pectin at the bind, the discharge and eliminate, and the support and balance phases of the approach to detox and layering. You have your own product, which is the PectaSol modified citrus pectin.
Right.
How does this work at the level of detox? What's it actually doing?
PectaSol is well published to remove heavy metals.
So it's binding, but but it's not drawing them. So, you know, you had mentioned, especially with cancer patients, you want to deal with what's circulating, not the storage. Exactly. So it's not helping pull out of storage. It's only helping what's hanging around in the bloodstream.
Exactly. But we have shown that because of the gradient concentrate and the reduction of inflammation over time, if you do a DMPS challenge test, for example, we published a paper, you'll see much lower mercury body burden when you use modified citrus pectin for a few months. Definitely.
That's very cool.
Well, because gradient, if you take all of it out of the blood, a little bit's going to leak back in from the
gut.
Well, no, from just anywhere it's stored.
Oh, you mean you'll now allow the system to start
actually, it's very interesting. I'm very fortunate. Here, I'll take off the slide. I'm very fortunate because I do therapeutic apheresis. I see how the blood of people looks. I see what comes out of the blood. So people can speculate from here to the end of the world. I look at the bag, I see what I got out of the person, okay? So I actually am privileged to see, and often I can diagnose a person just by what came out of the bag.
So what do you see?
You mean you actually visually see it, or you're
Yeah,
testing the
visually,
blood?
because all the
No.
oxidized lipids, everything comes into the bag. And I, in regular big centers, the doctor writes the order and the nurse does it. I look at every single bag. And if I'm out of town, they send me a picture. So,
So cool.
so one thing that we see, you give an apheresis treatment, you really clean the blood. Okay, the blood when you are done is like it was when we were 18 years old. Okay, LDL cholesterol is 30, between 30 and 40. Fibrinogen is like 150. CRP is 80% was removed. Growth factors were removed. Clotting factors were removed. You repeat it 2 days later. Well, the body is clean, right? This is to your question. So what do you think? You'll have more in the bag or less in the bag? You'll have always much more in the bag, because now the body can finally dump. The body is cleaned enough that the alarm mechanisms feel, okay, now I can take a deep breath and really make a change. So it's
I want to try it.
It's a second treatment. So this is the same principle. So you're right, through gradient, but also modified citrus pectin also mobilizes different compounds that help detoxification and regulates immune function. So for example, what modified citrus pectin does, it down-regulates the cytokine storm. Because we have to remember, survival is not owned by human beings. For example, the COVID vaccine wants, the COVID virus, the coronavirus wants to survive. What does it do to survive? It has its spike protein, right? Well, what do you think is the relationship between spike protein and galectin-3? They have almost the identical structure, because both are survival molecules. One is for a virus and one is for a human being. And the result is inflammation. So galectin-3 drives the cytokine storm from the top, and of course, it will damage every process, including liver process. For example, galectin-3 drives NASH, drive NFLDS, which is an epidemic in this country.
Yeah.
So obviously there will be an effect.
All right. Wendy is distracting me because she's opening your bottle.
Here, I'm going to take some. I'm like, why wait? Now's the time. I'm going to get going.
You've sold her. Sold. Done.
How to do everything for detox. Like, I'm all about let's live to 100 and feel freaking amazing doing it.
Here is a difference between this and any other binder. It's a binder, but you insult PectaSol when you call it a binder. Why? Because often when you have a binder, people get side effects. They don't feel well. Well, PectaSol down-regulates the abnormal inflammation. So that's why, for example, Lyme patients, many large Lyme clinics give PectaSol to every single patient. They don't get aggravation from the treatment. PectaSol will enhance antibiotic therapy. It is a prebiotic because it addresses.
Sold.
No,
I gotta try this.
You can borrow my water.
It addresses this very basic mechanism, this survival mechanism. And, we got fortunate on the gut research. We published a number of papers with the USDA. So everything is published research, it's not speculative, which is, it took only 30 years,
A mere drop in the water in the realm of humanity.
Well, you got another 60 in you, don't you? So
sure
those, who cares?
What I like about this is I've had PectaSol in the past that's liquid based, and I don't like the flavor. It's too sweet for me. So I have to dilute it in like a gallon of water.
But there is powder without the lime, just so you know, if you need. Yeah, but I also take capsules. I'm a capsule guy. I just pop them in and keep going.
Now, what's the fiber that we've used for mold?
Yeah, so the propylmannan konjac fiber binds to a lot of molds.
Yeah, I mean the different fibers, especially if they are if they are not charged, can definitely bind to different kinds of mold, and you can combine them. But you can use it with PectaSol, but Modified Citrus Pectin offers something basically different because it addresses our basic upstream driving force for inflammation, for immune dysregulation. It's really what it does.
Interesting. Okay.
So what else do you use in your detox protocol? So you're using the
So
PectaSol.
I'm doing a lot of work with pesticides. So I developed a formula called Detox.
Yeah, I have that too right in front of me.
And
Extracted though.
and
Thank
so it's based on the concept that pesticides have affected all the kingdoms, our water kingdom, right?
Yeah.
Our plant and meat kingdom as a result, and our mineral kingdom.
Yeah.
So my philosophy, whenever there is a problem, there's always been a solution. So I use regular high molecular pectin, not more MCP, to bind to pesticide in the gut. And I use alginates, and I use kelp. I use kelp because kelp is minerals, is protein, this is the nourishment part we discussed. And I use fulvic acid from shilajit, from a US source, actually, from New Mexico.
We have it.
Because
Yeah.
it's cleaner, because it has a lot of minerals, and we add glycine to stabilize, both to stabilize the gut membrane as a neurotransmitter support for glutathione, but also glycine is very similar to glyphosate. Glyphosate and glycine exchange, they almost look the same.
Interesting.
And there's a lot of work on glycine and glyphosate exchanging, creating neuroexcitatory, ADHD, autism. So we are doing a clinical trial. Our initial results with reduction of glyphosate are dramatic. Definitely very, we at the point we try to do clinical trial on anything we develop. We don't just put products out. And so yeah, so it's a very good combination together with PectaSol. So that's my basic kit is to use the PectaSol, which is really an ongoing thing because our galectin-3 goes up as we age. And again, we're covering a lot of ground today. This is much more than detox because that's our interest is more than detox. Yeah. But if you look at large populations at the age 50, the level of galectin-3 will really affect morbidity and mortality 10 years afterwards. If you look at the Birmingham offspring study, 8,000 people, and you look at people at the bottom 40% levels of galectin-3 and the top 20%, and there wasn't a big difference. There were 3 times mortality in 10 years.
Ouch. So can you just level check straight galectin-3 in the blood, or how are you checking it?
Yes, of course. Yeah, it's an approved blood test. Definitely.
So.
And have levels been standardized across labs? So, I mean, if you have LabCorp and I have Quest and someone else has another lab, is it standardized?
Great question. Supposedly, yes, because there's a platform by Abbott, but there is a difference actually.
So what's your preferred lab then?
Quest will tend to be higher. And right now, because the assay is automated, it's lower in general. So it's important to know because when you get the lab results, it may say that under 17.8 is normal. Completely not true. Anything above 12 is of concern. And you don't use modified citrus pectin based on galectin-3 levels because certain people, because of genetic predisposition, will not produce high level of galectin-3. Why? The device measures a pentamer and a monomer as 1 because it binds it here. So people who make more pentamers, it will look like they have less galectin-3 because if I break the pentamer, I get 5 in the reading. So the ratio between monomer and pentamer will affect the reading. But regardless, in our studies, people use MCP, get benefit.
So when you do the galectin-3, does it tell you the ratio of the monomer and the pentamer? No. Oh, so you're just going on. So some people are at higher risk, but you don't know it, but they look like they're lower risk.
Right, exactly.
Did I read that right? Okay.
But the reason for checking galectin-3, let's say you have a patient or yourself and you're really healthy, and you check galectin-3 and it comes back 18, 19, 20. First, something may be going on, and 2, you're at risk in the future. So you got to go on a full dose of 15 grams of PectaSol. In fact, if you're over 18, you can even consider 20 grams.
So
I can't see close and I can't see far. I can't read
So
this with my
I have
eyes.
So first of all, just practical, just because we're running up on time, it sounds like in addition to a vitamin D and a good, strong multivitamin, PectaSol should be part of your daily regimen.
Absolutely.
Okay. So if you're saying it's a binder, but it's not, but there's a lot more to it. But as a binder, I'm just from a practical point of view, binders usually we want to take on its own without anything else. Is that, how do you best take it?
No, you see, PectaSol gets absorbed into the bloodstream, so it's different. So it's not as necessary. You take it 15 minutes prior to eating or 1 hour after is fine.
Okay.
You don't need to separate it.
And
if you want to separate it from other supplements, 10, 15 minutes is enough.
Okay. So it's not going to interact per se, or
no.
Great.
And I think it's important because there's so much we haven't uncovered in this conversation. And I think it's really important because this sounds like a fantastic thing to add in, and that doesn't get you off the hook from eating organic and breathing and sleeping and moving and getting rid of traumatic relationships and a toxic relationship. It doesn't get you off the hook. It just helps you along. What were you going to say? You look like you had, I know you had something. I saw your face. We've been married a long time. Yes, Tim.
I was going to not say anything, actually.
A wise man once said nothing.
I have a joke about it, but some other time.
So I know what were you going to say?
No.
I know people are going to want to find you after this conversation. What's the best way for people to get in touch, follow you, find you, reach out?
So they can go
stalk you.
Yeah, they can go to dreliaz.com, dreliaz.com, and I have once a week I put a quality research-based newsletter. I got a whole team that works with me, and they can look at PectaSol.com and find out about MCP. And I really recommend to read The Survival Paradox. It's it has changed the lives of many people.
Yes,
it's amazing. Thank you. It's been an amazing time together.
It's like a drop
I've learned
in the
a lot,
bucket.
and I feel like I learn more and I get more. So it's awesome.
We're really grateful you were here.
Thank you.
Thank you. And thanks to everyone who listened to this episode of the Environmental Toxicants, Autoimmunity, and Chronic Diseases Summit. Our guest today is one of my favorite. I say that about all my kids too, Isaac Eliaz. And thanks for being here. Thank you so much.
Thank you.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks, real talks from real doctors on the issues that matter to you most.